next speaker is Sudlovenick. Inu is going to speak to Indigenous approaches to wildlife research in Inuit Nunavut. And Inu is originally from Iqaluit and is now faculty at the University of Prince Edward Island.
Thanks, Amy. Ooh, okay. Kuyanami, everyone. Kuyanami Gwen at QHRC, and Sephora and Micah for letting me be here from Nunavut near. Uvanga Enooyaq Sudlovenick, damani Iqaluit but surusiutilunga in those formative years that Joe was talking about, 1 to 5. I was lucky enough to grow up in Mitimatalik in Pon Inlet. Ennoyaq resolute baby doyui. And I'm going to talk about this paper that we're about to release. It was kind of a literature review, but also a critical look at OneHealth and how it's different from Indigenous knowledges. As Amy said, I'm newly appointed assistant professor at University of PEI, but I still am finishing up my PhD at U of M. I'm trying to figure out how to change. Okay. Nunavut my research is on marine mammal health. So I spend a lot of time out there, and similar to Aviaya's upbringing, I was very lucky to grow up with my parents on the bottom two photos. Atata Vinikutukulugatamani with his narwhal catch in Resolute Bay. One of my mom in her caribou skin clothing with my brother and her amauti. We were very lucky to grow up with them. So we spend some time diving out here. I've spent time on boats and hunting all the time. So that's a little bit about myself. So this paper, this OneHealth paper that we're about to release, came out of my PhD candidacy exam, 6 weeks of just looking at everything, really questioning how we come to know things. So the question that they asked me was, what's the similarities between OneHealth and Inuit knowledge? And it was a really good question. So it really brought us back to how do we come to know things, and approaches that recognize that context matters, and there's not a single truth out there that can be seen, understood, or controlled in a rational manner, was just trying to say that we should look at different worldviews because everyone has a different worldview, and that's fine. So just a little breakdown of my talk. This part, it was really looking at the history of the terms that were used in scientific research in, just the whole science world, how before they used TEK or Indigenous knowledge. In the 1980s, it was really about very species-specific information. And in the 90s, they tested how valid our knowledge was compared to theirs. And there was this weird, long time. It's still kind of happening, but it's less so. In the 2010s, it was more like extracting that knowledge and taking it out and pinpointing some of that for use. But right now, we're in a big paradigm shift, and it's very, very exciting. And I came across this one quote from First Nations botanists. Indigenous peoples are very scientific. It's just our science includes the heart. It takes up, that's just who we are. And we've heard that multiple times today. So this is just, a summary of the slide just before. I might skip through some slides because I don't want to, say the same things that we had been hearing today. But we know that Inuit homelands are very big. That means there's lots of specific history. There's lots of preferences between Inuit regions. Like here in Baffin, we might not eat the the whale meat as much as they do in the West and Northwest Territories. There's like little similarities like that or differences. And I quoted Joe's book, working for a common good, not being motivated by personal gain. That also goes into where we're seeing a lot more Inuit in research as well. So I guess just to bring that into the space about context. And in the paper, it really became obvious that co-management is needed to manage our wildlife, specifically our marine mammals. And there's lots of great examples in the Alaska Eskimo Whaling Commission. They co-managed their bowhead whale hunt. And they were the Enooyaq and Yupik people were very adamant that they co-manage it and that they didn't want NOAA, their version of DFO, to tell them what to do. And of course, the Iqaluit Commission is another example of co-management. So there's lots of successful examples out there, and they all say co-management is where we start. So that when controversial control measures like hunting bans are proposed, it's more acceptable by both scientific and Indigenous communities because they came to that conclusion together. They did that work together, that field work, the analysis, all that stuff was done together. So I also did a deep dive into OneHealth literature, and it really started as an emerging infectious disease framework in the early 2000s. So it is largely veterinary medicine and human health. And their main point is that OneHealth cannot operate as silos when faced with complex and serious issues. Like that's the basic idea of OneHealth. And it's OneHealth approaches are designed to address big issues like emerging infectious disease, that's a huge issue, or climate change, you need that approach to address that, or contaminants, like these big, scary issues. And again, we heard earlier that this was a method before, it just wasn't called OneHealth. And it's also used in other fields of study, like ecology. Ecology is pretty much OneHealth. So I did a big lit review and determine, well, lots of papers determine that as well, but just to really understand that the term OneHealth, if you do that in a literature search, it mostly is about diseases. It's mostly veterinary medicine, and there's not a lot of diversity in the disciplines. So there are a couple checklists out there that they're like, if you want to use OneHealth as your framework, you need to have these 14 or 20 things to be considered OneHealth, because most OneHealth studies aren't actually OneHealth studies. They're like, it's either human and animal and that's it, with no environmental sector. So there's only like really one or two papers out there that are like, this is what OneHealth is. If you're not including an environmental sector, then you're missing out a lot on a lot of information that could help you. I'm going to skip over marine mammals, the slide here quickly. I wanted to spend time on this part. So the human component part, specifically the Western thought and the Indigenous thought. So we heard a couple times how big the differences in our culture are between Inuit and Western thought. We heard that from Joe. We heard that from our friend in Greenland. And these different worldviews are really down to the core, where it's humans above nature in Western view, and in our worldview, it's humans with nature. And when the Western way of managing wildlife understand that humans do have an impact and directly on the ecological ecosystems, then we'll be in a better situation. So I guess the big part of this paper here is trying to point out that it is 3 disciplines. Like being a biologist, that's like one whole discipline, that's just the animal. In the human part, it depends if you want to the human part could be pretty vague. You could be like, oh, the human part could be social science, or it could be like human medical health. So it's like pretty vague there already. The environmental part is like, is it just about the atmosphere? Is it sea ice? Like, what is it? So it means if you want a successful One Health project, you're going to need at least 3 scientists from 3 different disciplines or something, because after all, they're all each their own disciplines. And we're not just talking about just scientists. So we also need qualitative researchers, health professionals. We need people like local knowledge holders and elders to make this happen, because if it's just one person being like, I'm doing a One Health approach, it's like, okay, that's a lot on your plate now, because One Health is really, it's 3 different disciplines. Like, it's a lot of expertise. There was also a few papers that were explaining their successful approaches to how they made their programs work, how they made like a moose study and management program work. And there was another one that's talking about elk, and another one was talking about caribou, and there were all these successful, amazing programs I was reading about. And all of them had this thing in common, where it was a local champion or a local knowledge broker that was the link between the researchers and the local community members, where this person had a very specific role. It was a full-time job. You didn't lose them half the year to another job, because if you're trying to hire a bear monitor protector, that's only a seasonal job. And then the rest of the year, what are they supposed to do? They'll get a full-time job. You want them again next year, they're like, sorry, I already have a job. So this full-time local champion is there to see and hear, gather info and data from various sources, report to both sides, and guide by a 2-eyed seeing leadership. So this was mostly a First Nations approach, as you can tell from the use of the term 2-eyed seeing. But at the end, we did determine that One Health and Indigenous knowledge, IK, or Iqaluit, they're 2 very separate knowledge systems right to their core. But One Health can be the bridge between Western science, so WS, Western science, and IQ and IK. That crossover of IQ, IK, and Western science, or One Health, that crossover is very low. There's not that many papers out there that combine One Health and IQ or IK across the Arctic. But again, it could be a great bridge between Western science. And I wanted to end off with this quote. I quoted this book a lot. It was a really good book. It was One Health in the Arctic. It's innovative and disruptive approaches are needed to address shared health threats, such as climate change, urbanization, and pollution, because business as usual is insufficient to inspire the necessary actions to protect the health of one species without risking the health of another. So I see a lot of innovative and disruptive approaches today, and I'm excited to hear more about them tomorrow. With that, I'd like to end with this beautiful artwork by Christy Belcourt, which just shows that everything is connected, all the way from the plants to the birds to everything, and walking softly throughout the world will just remembers that we're connected to everything. Enooyaq, thank you.
Thank you very much, Inu. Would anyone have a question for Inu? Yeah? Or comment, yes.
Yes, you can hear me. Okay. Thank you so much. It was very. Absolutely, Savit. You want to go first? No. Okay. It was very inspiring, and I really like how you also say that we need the qualitative. We need to talk to people as well, when we are researching the environment, the ecologic, the whole of it. So it was just really inspiring to listen to your presentation. Thank you so much. Yeah, you're welcome.
Apeqqutiksaqqalua tungale ila utseqasuoqigakku inuillu oqallaqattaqlute unikkaaqattaqlutiklu qauyimayamini utseqsarsamayummarialorma tasuoqaama silamingni piluartumeqai sivuriqiyavuta aniinginnaujaqtukku qauyimayummariulormat tamakkua qausarneriaoqattartut utseqeqattarpigi suorlu naasautiinukua naruneersituinnartut qauyimayauvagiqtumi tukisinarpunga does the numbers confirm or the data confirm what is already known by Inuit is a big question.
Yeah, that's something I think any Indigenous person in academia struggles with that very question all the time. They're like, why am I even trying to get a PhD? Like, we already know this. What am I doing? And I think, I don't know, my experience with it has been, well, in like Western science, has been very different than how I grew up. But I think sometimes having both of them is really amazing thing to see. Like, we can't smell how much mercury is in our country food. We can't touch how much like contaminants might be in it. So sometimes those numbers are good to see. And then sometimes it can be really scary too, though. So I guess I focus on contaminants and diseases. So for me, that's what I focus on because I'm like, I can't see that right away. So that's why I'm studying it. But I don't know if somebody else who might be in population management might have a better answer to that. Yeah. Yeah. Thank you.
Thanks very much, Inu.